material here, because we're gonna have you stand, the three speakers will stand with the mayor here.
Okay.
Dr. Mumin, we'll probably have you on this side. Yep. And we'll have you bring you here, you know, you'll be standing here. The mayor will speak, and then we'll move one at a time. And if you're here to put your papers down or anywhere in here, we can do so. Just make sure we'll make sure nobody takes your documents. All right. Mr. Adabi. Thank you, everyone. We'll get started shortly.
Good afternoon, everyone. I know we haven't had lunch. Good afternoon. Everybody okay? All righty. Hi there. All righty. Thank you for being here today. Unfortunately, I wish it was under better circumstances. But, as you can see, I am joined by many state, county, and local officials to discuss how we will respond to the likely event that the coronavirus or COVID-19 reaches the County of Berks and the City of Reading. I am grateful for their presence and active involvement. First, I want to say to our Reading residents that now is not the time to panic, and that the best way that we can flatten the curve is by following best practices established by the Center for Disease Control and Prevention and the PA Department of Health. While we understand that the situation is quickly evolving, I know it can be overwhelming and scary to hear that you should stay home if you are sick. Still, we want everyone to practice healthy habits to ensure the health, safety, and well-being of all our neighbors. Second, I want to strongly advise that our residents follow the science and the medical advice given by professionals on this issue. It is easy to fall into mass hysteria when gathering information from social media. Although these are great tools to disseminate information, they are often used to spread misinformation. So whatever you read on social media, it should be read with some caution. And you should always follow your primary care physician's advice when making medical decisions about you and your families. Third, I encourage the suspensions of any large gatherings of groups larger than 250 people. It looks like most institutions are already doing this, thanks in large part to the Governor Wolf's effort to contain the virus across the state. But I urge the community to do more to help us prevent our most vulnerable populations from becoming affected. Finally, to the residents of Reading, I want you all to know that my administration is working around the clock with our partners at the local, state, and federal levels to get the most up-to-date information, and also to work in coordination if and when the virus arrives in our city. While these are unprecedented times, rest assured that your government is always working in your best interests. With that said, I often use the phrase, "we are each other's neighbors." And so, in the spirit, I ask all of Reading to be good neighbors, and please check on those who are most vulnerable to this virus and help them however you can. Specifically to the elderly and those with special needs. Whether it's grabbing food or supplies for them, or getting prescriptions filled, we can all play our part to help others during these trying times. Next, you're going to hear from experts on how the County of Berks is preparing for the coronavirus arrival and what specifically you can do to help reduce its spread. So with that said, I welcome to the podium Berks County Emergency Services Director, Mr. Brian Galcho.
Good afternoon. Thank you, Mr. Mayor and City Administration, for hosting us today for this discussion on COVID-19. Berks County leadership began discussing this important matter, planning the county's response in the last week of January. We started to interface with our local acute care hospitals in the first week of February. While we hoped that our preparations would be unnecessary, we also recognized that the time lost were we to wait would be unacceptable. Berks County, like 56 other counties in the Commonwealth of Pennsylvania, relies on the PA Department of Health for public health guidance, among many other health-related services. While we're appreciative of the incredible resources this state agency provides, the commissioners of Berks County are also keenly aware of the enormity of the department's mission, especially in times of widespread public health emergency. The county is committed to acting to bring the guidance of DOH to the Berks region with as much clarity as possible. We've worked to establish a web presence for local coronavirus-related matters through the Department of Emergency Services website at www.berksdes.com. At that page, Berks County residents can find convenient link outs to reliable sources of COVID-related information, including federal and state public health authorities and public preparedness resources. Most importantly, information of a local nature will be posted on this page. It is our hope that this will become the single convenient starting point for all Berks County residents desiring information on COVID and the current response efforts. We're compelled to note that a public health emergency is unlike many of the emergencies we confront more commonly. A fire, tornado, or hazmat incident presents a scenario where the individual citizen can do little to fix the problem. Generally, emergency responders are summoned to set the situation right. A public health emergency is precisely the opposite. There's little that emergency personnel can do, but the individual is enormously powerful. Cover your cough or sneeze. Wash your hands regularly, using sanitizer only when soap and water are not an option. Minimize touching your face. Practice social distancing and avoid customs like handshaking. And do not assemble in large groups, particularly in enclosed spaces, as this amplifies the ability of the disease to spread through the community. People, each of us individually, as families and as a community, are the key to mitigating the effects of this virus. We must act aggressively in changing our personal conduct and work to remind each other when we backslide as individuals. The need for our aggressiveness and attention to these simple public health mitigation actions is countered by the need for calm in many other ways. Hoarding of food and supplies, the wearing of respirators or face masks by persons who are not sick, demanding to be tested for COVID despite presenting no clinical signs or risks that justify the testing, overwhelming our EMS system in emergency rooms when we're simply worried or not emergently ill in a way that necessitates that level of attention. Perhaps most importantly, believing this situation is a hoax or not worthy of your attention. These are all examples of conduct we must avoid and that can present as much of a risk to the community as the illness itself. This is not seasonal influenza. Information presently available regarding the length of time that this virus remains viable on surfaces and the lengthy incubation period of the virus in humans before the host even necessarily knows they are ill means that despite any beliefs about the impacts on a particular person, this disease is a profound public health threat. While our county and local governments and non-governmental first responders are preparing to implement their continuity of operations plans to ensure that public services can still be delivered if there is a reduction in available workforce, and our hospital and healthcare facilities are doing the same, we implore each and every citizen to do their part by staying informed and engaging family and friends to help spread the message. Please follow the directions of public health authorities and think perhaps not of yourself, but of those in our community who are at heightened risk of complications from this disease due to age or pre-existing medical conditions. It is for this part of our community that we must all act responsibly. Again, please visit www.berksdes.com for easy access to information. Thank you, Mr. Mayor.
Now, please welcome to the podium our very own Superintendent, Dr. Khalid Mumin from the Reading School District.
Thank you, Mr. Mayor. First and foremost, thank you for the collaboration between the city, county, and state officials as we address the potential of COVID-19 entering our schools. As you know, Reading School District has the duty of educating over 18,000 kids and working alongside over 2,000 staff members. To date, Reading School District has been in constant communication with the city, with the county, with the state officials in regards to preparedness in addressing COVID-19 and the needs of the Reading School District students and staff. To date, we've been following the guidance of the CDC, the Governor's Office, PDE, and PA Health Systems in regards to how we shall address the infiltration of COVID-19 in our schools. Currently, today, as I speak, the Reading School District is closed as we are partaking in a deep cleaning of all of our facilities, focusing on all exposed surfaces, and that's being conducted today through Sunday. I must say that I'm very thankful of our team of professionals in the district who have worked together collaboratively to be able to pull off such an effort in such a short period of time. Beginning on Monday, the focus will be there will be a steadfast focus on the daily maintenance of our facilities. Very similar to how we may conduct ourselves at home with Clorox wipes, wiping up messes, having students cover their cough, having tissues available, and hand sanitizer as necessary. In preparation for the future, we will continue to follow the guidance of the CDC, City, County, Governor's Office, PDE, and PA Health Systems in the event our circumstances change here in Berks County, and especially in the city of Reading, thus impacting the Reading School District. This will include the possibility of school closures, cancellation of trips, postponement of activities that have more than 250 spectators, and establishing feeding protocols for our students if an extensive quarantine is mandated by the governor. That's extremely important for us as the 18,000 students that I mentioned earlier. As we all know, our students are in a population of 99% of our students are underserved. So feeding is extremely important. With the collaboration of our community partners, more specific, the Olivets Boys and Girls Club, Centro Hispano, and of course the city, we will look at ways to how to feed our students in the event that a mandated quarantine is necessary. Again, thank you to the mayor, the county commissioners, Senator Schwank, the governor's office, the councilmen, councilwomen, and most important, my staff at RSD. RSD proud, because for us to be able to pull off such a monumental task of cleaning our buildings, all 19 sites, in such a short period of time, it takes the collaboration and teamwork of all of our professionals. This is all about maintaining the safety in our schools, making sure our students are safe, making sure our staffs are safe, and that we have healthy learning environments. So again, Mayor Moran, I thank you for bringing us together as we discuss our plans and how we're all in the same accord. Thank you, my pleasure.
Now, please help me welcome to the podium Vice President of Tower Health, Dr. Charles Barrera.
Thank you, Your Honor, and thank you for having me. I really want to talk about three things today. First is, what is coronavirus? Coronavirus is a virus much like the common cold or the common seasonal influenza. It's spread very much the same way. It's spread from person to person. So when understanding how to tackle this virus, it's very important that we understand how you get it. And when we look around at some of the things that have been put into place to contain the virus, the social distancing, the cleaning, we realize that this virus is spread from person to person. So one of the things that would manifest if someone were to have the virus would be really a cough and a high fever. And how do I know if I have it? Well, there's really, the risk factors are fairly low at this point. You would have a cough, you would have a fever, but you'd also need to come into contact with somebody with the virus. You can't just get the virus in the environment, in the air. You get it from someone else. So how do I know if I have the virus? Well, currently the Department of Health is providing all the testing for the virus. And they have screening criteria that have been recommended by the CDC and the Department of Health for who gets tested for the coronavirus. And really, there's some criteria that need to be fulfilled prior to testing. And that would be a fever, a cough, as well as either travel to one of the areas, one of the countries that you've seen that the virus is endemic or it's around a lot, and two, being in contact with somebody that has a positive test. When we say contact, we mean within 6 feet, close contact. But thirdly, what I think is most important is that this virus, like other viruses, there's not a magic pill to treat the virus. And most people that get this virus, if they were to get it, will do well. And to echo His Honor's comments, those people that are most susceptible to this virus are the elderly and those with immunocompromised. So those with cancer, those with transplants, those lung disease. This virus tends to attack the lungs. Those are the people that we worry most about because those are the people that have the need for most supportive care. So as I talk about this, I want the community to realize that the coronavirus affects different people differently. Emergency services, and Mr. Gottschall spoke very well about that, and the healthcare facilities are here to protect the community, and we really need to focus on those people that are really sick, that are demonstrating effects of illness. And that could be the virus affecting the lungs and people not being able to breathe, or it could be a car accident. It could be a fire, it could be other things. We want to make sure that we have those emergency services intact for the community that needs us. And if people would like to know more about the virus, I think Mr. Gottschall gave you the website, and the Pennsylvania Department of Health is the one organization designated by the governor to disseminate information for where the virus has been isolated and what counties have have patients with the virus. Thank you. Thank you, Your Honor.
I also want to add that there is a toll-free number, which is 877-PA-HEALTH. Again, 877-PA-HEALTH. I also want to acknowledge that all these remarks are going to be translated into Spanish, and we're going to, each and everyone that is here is going to put it on their own respective website, as well as here in the city of Reading. I will also going to make myself available at the end of this conference to read my comments in Spanish for any media outlet that would like to record that, to make sure that it reaches every single person in our city. I also want to take advantage to thank our city staff who have been continuously working with our administration to make sure that we get the last up-to-date information and that we remain calm and sanitize accordingly. So thank you all. I also want to acknowledge many individuals that are here that have been in communication with our office and made this press conference available. And then we are going to go into a Q&A to answer any questions. But I do want to acknowledge President Berks County Commissioner Christian Lineback, Berks County Commissioner Michael Rivera, Berks County Commissioner Kevin Barnhart, Berks County Chief Administrative Officer Ronald Seaman, Reading Fire Chief William Stout Jr., EMS Chief Walter Bauer, who is from the city of Reading, and the Deputy Emergency Management Coordinators, Lieutenant Kurt Lissenberger from the City of Reading Fire Department, Reading Police Chief Richard Trinelli, our Senator Judy Schwenk, State Representative Tom Calder-Jerome. I also saw Mr. Chad Schrager from from State Representative Mark Rossi present. Thank you. City Councilwoman Marsha Goodman Hernership, City Councilman Stratton Mamaruth, City Councilwoman Donna Reed. Also with us, Executive Director of the Water Authority, Mr. Bill Murray, which acknowledged to me earlier today that they're gonna make like a canteen. They call it a water buffalo. Is that correct, Mr. Murray? He's gonna make themselves available at the parking lot to provide free water to any resident that is in need of water, for drinking water or for usage, correct? Correct. And you could ask them more specifically after we conclude. I also saw in my present my former colleagues from the Reading School Board. Thank you for being here, Robin Constable Jacobson and Mr. Leo Martinez. So now I'm going to ask my Manager and Director, Mr. Pedro Cortez, to please come and assist with the Q&A. Thank you.
Thank you, Mr. Mayor. Thank you for joining us. The message is rather straightforward. We're each other's neighbors. We're working collaboratively, the state, the county, the city, by extension, the federal government, to address this very serious issue of the coronavirus. As the mayor noted, this is not the time to panic, but it is serious. But we want you to know that your officials and many other administrators care deeply about the health, safety, and well-being of everyone, and that includes our county residents as well as our visitors. We have a couple of minutes to do Q&A, and I'll redirect the question to the best person to answer your question. I ask, the speakers will keep it brief. Do want to point out again, it's important to note that, as the mayor indicated, the remarks that are given today will be translated into Spanish, and while we will post them in our respective websites for our organizations, I will encourage you again to visit www.berks.des.com, and the DES stands for Department of Emergency Services. And that's where the information will be also placed. And again, questions related to the coronavirus and any of the latest health information, in addition to being on the same website, can be answered if you call the Pennsylvania Department of Health at 1-877-PA-HEALTH, and that is 1-877-724-3258. And with that, I welcome anyone in here to ask questions, and we'll ask them briefly. Yes, sir.
I would say that, anyone is at risk for the virus if you come into contact with someone that has the virus. What we really are concerned about are what are the effects of the virus, right? So someone that has compromised lung capabilities would potentially have a worse effect on their body from the virus than somebody that doesn't. Now, many people that smoke have lung decreased capability. Many that smoke do not. So I don't think that it would be safe to say that everyone that smokes is more susceptible to the virus, but people with emphysema, it is known, do suffer more from the effects of the virus than those without.
May I ask, is Reading Hospital prepared or making preparations? I don't want to overblow this, but in the event of a worst case scenario, making preparations to meet exponential demand for treatment?
We are actually working with everyone that you see here to make sure that this community has what we need in the event that there would be a surge in cases, so yes.
Mr. Mayor? Please, you can come up.
Water Buffalo will be located at our administrative office, 1800 Kutztown Road, Monday morning at 8 o'clock through 8 o'clock p.m. And depending on the utilization of the public, the mayor and I have had some preliminary conversations about making other locations available for convenience of people, so that what they can't get on the shelf, they'll be able to get from us directly. Monday morning, 8 o'clock.
So when
8 to 8, yep.
And again, you have the address, but we're talking about the Reading Area Water Authority. And thank you, Executive Director Bill Murray, for that. Other questions? Yes, sir.
I do not, but I believe that the Department of Health actually, orders and evaluates and performs all the tests. They may have that on their website that's been available. I don't have access to that information. I think that thinking that you have the virus would warrant, maybe if you feel at risk, would warrant a telephone call to your primary care provider. What really the standard would be to really not introduce that virus to an emergency department or somewhere else where other people have the virus. So what we've seen best practice and what's been happening throughout many health systems, including ours, is that people would then communicate with the Department of Health. They would evaluate whether a test is warranted or not, and then arrange for testing. In some counties, that testing is done in the person's home. In some counties, it's done elsewhere, and I think Mr. Gottschall alluded to some of that, where, if you really want to protect the healthcare institutions so that they can operate and meet the needs of the patients. So that's the information I could give you.
We're going to ask Mr. Gottschall to provide additional details.
Just to add to Dr. Berbera's comments about, and to repeat for the public, as I'm not sure they can hear the questions, what do I do if I think that I have the virus? And Dr. Barbera answered that very well. One other thing I would add, if you would go to our webpage, there's an excellent infographic provided by Department of Health that is intended to help people to understand what actions to take and not to take. In particular, if you're just worried about this, but you have no reason to believe that you actually are ill, there's the 877 PA health number can be called, and you can speak with a health professional who can give you further advice. I think that Dr. Barbera would agree that we don't want to discourage anybody from going to their doctor or going to the emergency room for appropriate medical care for whatever condition may be upon them at the time. What we're hoping to avoid is people overwhelming doctors' offices or emergency rooms for no reason at all, simply because they're worried. Thank you.
Anyone else from the media? Yes. What? If you can, yeah, we want to make sure that was a good point that we repeat the question as it's asked so that everybody can hear it. But go ahead, please.
So the question is, does a pneumavax or the pneumococcal vaccine, does that provide protection against the COVID? And no, the COVID is a virus and pneumococcus is a bacteria. So while they both present with pneumonia, the COVID is actually a viral pneumonia, and the antibodies to the pneumococcus bug, if you will not be effective to the virus.
We'll take 2 or 3 more questions. Yes, please.
Yeah, so the question is that if I have any advice or any concerns for the small business owners that may or may not be affected by this virus? Is that coming out? Okay, very well. So I'm just going to repeat what I said in my earlier statements, that we should use a good judgment on decision makings, on being out in the public. I use what the governor stated in events of 250 more that you should try to refrain from attending. But the same goes for a small business. When going out to the public, use the proper practices of, making sure you wash your hands and all the advice that have been given today. So nothing different than what has been stated already.
And the reality, if the question has to do with, the economic implications, they're certainly real, and everybody's feeling them. We know that many universities have closed their campus and are moving towards online instructions. Sporting events have been canceled, and I think again the impact is enormous. That being said, ultimately, it's about the minimizing to the extent that we can the spread of this virus. You heard how it's transmitted; it's person to person. So to the extent that you can avoid that, you will see if you come here to City Hall outside the mayor's office, mayor who loves to shake hands and embrace. There's a message out of his office that say, we receive you with a big smile and an open heart, but in order to avoid, even the possibility of spreading the virus, we're gonna welcome you with that open heart, but we'll avoid the in-person contact. So we're not discouraging our neighbors and our friends from being humans and doing what they do. but it's important to realize that these are very unusual times. And again, the governor yesterday, when he did this press conference, was more specific as to suggestions, and I would recommend visiting the Department of Health and also the Berks County DES website so you can see more. But as part of it is a little bit of good judgment. That includes, for example, wiping the areas in which you work. A podium like this, you see, I put my hands down already. Others will do so as well. Just wipe it, and the instructions and the steps that are being taken at the school district, for example, are model for what should be happening in all places. And obviously, if you, as a business owner, show any of the symptoms of the virus, you should also exercise caution and not make yourself then present and available to perhaps potentially transmit that to others. We'll take one more question if there's one. Yes, sir.
Yes, for clarification purposes, the school district is closed today. The entire district is closed today. Monday is a professional development day, which means that the staff will be in, but not the students. During those professional development activities, at the end of the day, we'll get to our daily maintenance of our facilities in regards to, so to really break this down, this weekend, the action steps that are being implemented are being done by our facilities teams, food services teams, our secretaries, and also Safe Schools. So on Monday, the teachers return with the administration, and then that will be the premonition of all of the routine and daily cleanup. Similar to what has been said earlier today, just daily maintenance, very similar to as you clean up at home. If there's a cough, cover your cough. If there's a mess, you clean up your mess. If there are open surfaces, pull out the Clorox wipe and wipe surfaces down on a daily basis so that we can remain diligent and stay in front of this. Thank you.
And before I ask the mayor to close the program, as a reminder, as he noted, the mayor will make himself available not only to present his remarks in Spanish, but also to ask questions for the media. Some of the members that you see here will do so as well. The governor yesterday in his remarks also noted, and he was in a hard mandate, but it was a word of caution that again for the gatherings that may happen as a result of faith days coming together. The other gatherings will, social and the others, we are hoping that everybody exercises great caution. The governor spoke about, the hospitals, the supermarkets, and all that will continue to be open. We need to be here for each other and for our neighbors, but we cannot reemphasize enough the importance of being judicious at this time. So with that, Mr. Mayor.
Again, I want to thank each and every one of you for being here present today. I specifically want to thank everyone that has taken part in this press conference and your continued service to our community, elected officials alike. Thank you so much for that. Para mi gente, primero quiero decirle a nuestros residentes de Reading que ahora no es el momento de entrar en pánico. A la mejor manera de combatir este virus es siguiendo las prácticas establecidas por el Centro para el Control y Prevención de Enfermedades y el Departamento de Salud de Pensilvania. Si bien entendemos que esta situación está evolucionando bien rápido, sé que puede ser abruptamente y aterrador al escuchar que debemos detenernos en las casas si estamos enfermos. Pero quiero que por favor usen precaución y mantengan sus vidas diarias, pero que vamos a ser responsables. Le pido que vamos a ser buenos vecinos unos con el otro para ayudarnos uno al otro en momentos de necesidad. Esta oficina siempre va a estar disponible para ustedes. Todo lo que se dijo hoy día se va a repetir en español. again, I'm going to stay here for any media outlet that would like to do the recording and my comments entirely in Spanish, and the comments that were made by the other professionals and staff would also become available in Spanish in the next couple of days. Thank you all so much. May you all have a wonderful day. God bless you all. Thank you.
I certainly understood we're trying to get some. I understood the answer. We'll get to it. We just translating.